This lecture is on traumatic brain injury. Now, we've talked about a lot of different general things in this course. I thought we'd focus on one thing for this lecture. This has been in the news a lot lately, both with issues of athletes having concussions or soldiers coming back home with traumatic brain injury. What is happening to their behavior, to the physiology in the brain, and what are their prospects for the future? So we can look at two different categories of brain injuries. One is an open head injury. This is where the skull is open, bullet wounds, traumatic injury due to shrapnel, things like this. These are penetrations of the skull. And closed head injury concussion. Keep in mind that the skull is a very strong protecting case for your brain. You have also the dura mater, very protective, but it doesn't mean that things can slosh around in there and cause a great deal of damage. There is a scale to look at the degree to which a concussion is severe, and this is a Coma scale. It's called the Glasgow Coma scale, and you get a ratings on these scales. Open eye, spontaneous speech, you kind of score them on this level, on this level, on this level, and they get a score. And if it's scores greater than 14, it's minor, and under 9, it's severe. It's just a way to quantify the degree to which somebody has had a head injury. So when we talk about concussions, this is something where it's looked at both in terms of symptoms, but also in terms of activity in the brain. So we might have a post-concussion syndrome, which we'll talk about. Something a little bit more intense is like a traumatic brain injury, a mild traumatic brain injury. These can produce a lot of different types of behaviors: headaches, moodiness, personality changes, sleep disturbances, vomiting, photophobia, which is a phobia of lights, memory loss, things like this. And this can last a short term, this can last a long term. And there may even be delayed onset. Some football player may get a big hit in the game, not really feel it till later. When we talk about blows to the head, we have injury to the part that is hit, like in a bat or a football player, or maybe a soccer player hitting a ball. That's called that spot. The primary impact is called the coup, and then because the brain sloshes around, it's kind of stuck in the skull, held together in a kind of a matrix, that arachnoid membrane. It can actually slosh back, and we see this happen a lot in, for example, automobile accidents. We call this the coup and the contra coup injuries, or that can cause damage. So somebody might be hit in the front, but get a lot of visual information problems because the back of the brain hits as well. So remember, think of the brain as being kind of like jello. It sloshes around. It's not a hard substance, and that can cause tearing, tearing of white matter. It can tearing of axons, spilling of different types of neurotransmitters, or sodium or potassium, and things like this that can damage the rest of the brain. So even though somebody might have a very strong helmet on, then that brain is still going to slosh around, still going to cause a lot of damage. So here are some things that can happen. You can get bleeding, which is known as the subdural hematoma. This is bleeding under the dura mater. Now, that can happen in the coup and the contra coup injury. If that bleeding isn't relieved, it can cause a great deal of damage. It can also cause swelling of the brain. The brain has nowhere to go except for up against the skull, and again, you're going to start having a lot of cell death. You can also have white matter injury, which these are the myelinated tracts that you can really see in a cross section of a brain, and these can tear when the brain is sloshed around, where the brain is twisted. Let's say somebody gets hit in the face in boxing or something like that. One of the biggest problems of a concussion is that you don't see bleeding. You don't see the injury, but there is still a lot of damage inside the brain, inside the neurons. These neurons can tear. Glutamate, for example, the neurotransmitter glutamate, can kill a lot of other neurons if it isn't kept in check. It is a excitatory neurotransmitter, and so if a lot of neurons are split or torn, and you get a lot of things like chlorine, potassium, and sodium and glutamate floating around and affecting other cells, you can actually have greater damage than the actual insult itself. Take, for example, an explosive device, an improvised explosive device, sending a shock wave that goes right through the helmet into the brain, causing tearing. Then that can cause further and further damage as all these neurotransmitters are released. It can cause swelling, which also increases damage, also increases that pressure. One of the things that they do in field hospitals, especially if there's an open head wound, is they can add things to cool the brain, which may reduce the impact of glutamate, the neurotoxicity, the killing nature of glutamate. Another thing is known as microdialysis. They might actually go in with what looks a little bit like a needle and pull a lot of the fluid out of the brain, get that glutamate out of there, so we don't have the neurotoxicity of the glutamate that's been released because the brain has been torn. So imaging can be a little bit tough when it comes to concussions. It's only really been recently that we see some good imaging techniques. So CT scans, MRI scans can help in determining concussion, but may not. Another device, pretty recent, is called the diffuse tensor imaging. This provides a little bit clearer indication of damages to the brain because of a traumatic brain injury, because of a mild traumatic brain injury. So that's oftentimes used. Okay, a post-concussion syndrome, we see this a lot in athletes, we see this a lot in soldiers. It might not be this giant explosion, it might just be somebody getting hit in the head pretty hard by another player or something like this. And what you get from this is a lot of those types of symptoms I talked about. Now, these may go away in a couple hours. Headaches, hypersensitivity to light, memory problems. They might go away pretty quickly, but if they don't, if they tend to persist, you might get the diagnosis of a post-concussion syndrome. And there's a lot of theories of what is causing this, damage to different parts of the brain. You get mood problems, memory problems, personality changes, depression, and chronic pain, things like this. Of course, headaches. Another idea is that a concussion may affect the hypothalamus and the pituitary. And the anterior pituitary and the hypothalamus are regulating hormones. So sometimes people with damage to this area show a lot of these similar symptoms. So one of the idea is that this area is being affected as well because it's very fragile and it's feeling that force vibration go right through the brain. So one of the big issues that they're dealing with right now in sports is, what do you do if somebody takes a good hit in the game? Well, what's the level of that hit? Let's take football, for example. If somebody takes a good hit in football, they have a very strong helmet, so it's not an open wound injury, but the brain gets jostled around. Well, what we do know is that at that point, the brain is very fragile. It's very fragile to further injury. So if the football player is saying, no, I want to be back in the game, I really want to keep playing, somebody has to be an advocate for that individual and say, you need to be out of the game for this week, you don't need to practice for a week, those kinds of things. Let the brain heal a bit, because the second impact can be extremely damaging. We even call it the second impact syndrome. And here's an example of an individual that suffered a mild concussion in a football game. And unfortunately, he went back in and experienced a second concussion and was severely disabled by this. In other words, he never really recovered very well. He lost a lot of his cognitive functioning, memory problems, and of course couldn't play sports anymore. But we have this kind of culture of resistance, and I have to admit there's some changes going on here, but they are relatively limited. So what we're finding is even young kids can take some really good hits in a game when the two heads collide. A study found that kids took hard hits about 107 times. This could be up to 80 Gs. A G is a gravity. This is a tremendous hit on that kid. Between 40 and 50% experience a concussion in a season. Those are the ones that report it. And 35 players say that they get more than one concussion in the same season. We get into that multiple concussion problems. But, this is a game of toughness, and this isn't the only game, Other games show this. Here was a poll that was done. It was support for high school football. This was an article that I read in NPR. It surveyed a bunch of parents, and it said only 7% thought that the game was too risky for their kids. 44% saw the game and said it needs to be safer. But still, almost 40% said, hey, it's what happens in the games. Injuries are inevitable. And also remember that the frontal lobe is developing a great deal in adolescence. It's not fully developed. It's going through a development stage. If it is taking a lot of injuries, these can be long-lasting problems on the child. Let's look at athletes. What about athletes that get 3 or more concussions in a season? They become hypersensitive. Their brain is extra sensitive to concussions. The further damage can really exacerbate that problem. And then they tend to have lower GPAs, and they tend to have long-term risks of brain damage, long-term risks of cognitive problems. This is a serious issue. Now, I've been talking a lot about football because it's been in the news a lot. Football in high school, football in college, football in professional football players. Hockey has a really high level of concussions as well. Soccer. Here's the question that people are starting to ask. Should you be headbutting the ball? If that ball is being kicked from 30 yards away and it comes down, it has a tremendous force that is felt through the brain. That force goes through the brain. And just because the skull is there to protect the open wound doesn't mean the energy from the ball isn't transferred through the brain. Not to mention the fact that if two people are going up for the same ball, their heads can collide. A lot of people don't realize just how many head injuries we get from cheerleading. Cheerleading might not think of as a sport, but it's terribly brutal, and there's a lot of damage to cheerleaders who fall. So what are we seeing in athletes, especially athletes that have been in professional sports for a long time? What we're seeing in the brains of professional football players, professional boxers, people who have taken a lot of concussions. We get what's called Chronic Traumatic Encephalopathy. That's a hard word to say, encephalopathy. And this is the progressive loss of cognitive function and memory. This is a degenerative disease. You get Parkinsonian symptoms sometimes. You have mood problems, emotional problems, memory problems, certainly. And this is marked by a degeneration, a shrinking of the brain, and a lot of dense tau protein. Where did you hear tau protein before? Where do you see a buildup in tau protein? From the last lecture? In Alzheimer's. So what you get is, because of this constant blow to the head, you're going to start building up these proteins and start getting early onset of dementia caused by primarily the hits. Okay, so if you look at chronic traumatic encephalopathy, here is a normal brain. Here is one with the black tau protein buildup. You can also see a shrinking of the brain because the cells are dying. And here it is in a real severe case. We're starting to see this tau protein buildup in the brains of athletes who have died prematurely. And there's been a number of cases of athletes who have committed suicide and written a suicide note to say, look at my brain, I know there's something wrong. We're seeing this tau protein buildup and the CTE. Okay, so here is an example of a high school athlete, played multiple sports, and one thing I think we need to remember is it's not always necessarily the long-term athlete. And it's not always necessarily the individual that gets a lot of big concussions, like blackout kind of concussions. There is some evidence that a constant hit, even if these aren't tremendously hard, let's say the hits that they take in practice over an extended period of time, we begin to see the buildup of this tau protein in the CTE, even with this individual who's been an athlete, worked hard, but hasn't necessarily done it their whole life. There's an actual dementia called dementia pugilistica. A pugilist is a boxer, pugilistica. And it used to be called punch drunk. Old-time boxers who could barely talk, who had shakes and Parkinsonian symptoms. And even with a helmet, even if they wear a helmet and cushioned gloves, you're still going to get a lot of that force going through the brain. Here is an example of Muhammad Ali, who has Parkinson's disease, which is probably brought on a lot by his years and years of boxing. You also see dementia pugilistica correlating with CTE and the buildup of tau proteins. So this is something that we're grappling with now. What is the long-term effect of these sports where aggression is built into the sport? Now, if we're going back to football, here they have these very fancy protective helmets, which has led them to maybe lead with their head when they tackle. And that is producing less and less people dying on the field. People used to die on the field more with open head injuries, less of that, and a lot more of this buildup and tearing of tissues. One of the most famous cases is Junior Seau, who committed suicide, and he donated his brain, saying there was something very wrong. The NFL recently settled a $765 million lawsuit about this long-term effect of a head injury on their players. Football is sort of leading the way, but there's other sports that are looking into this as well, and maybe changing the dynamics of the sport early on when kids play in high school and college about protecting the head and not leading with their head, and having something more than a 15-yard penalty when somebody leads with their head when they tackle. Something that's a little bit more severe as a punishment. If we look at this one, here's an interesting chart of football players, number of concussions that they've had, and the percent of depression. Remember, depression kind of goes with everything, you know. When the brain is being knocked around like this, you're going to get a lot of these other kinds of symptoms. Those symptoms can lead to depression. What about soldiers and Marines and airmen who are out in the field? Take a look at that blast. Do you see that blast pulse of energy? What's happening with these explosions is not only are they throwing shrapnel and causing great wounds and causing great damage, but there's so much energy packed in those explosions. They go waving through the brain and they tear as they go. Just the energy wave alone. And what we're seeing because of Iraq and Iran and these improvised explosive devices increasing what are we calling the invisible wounds of those wars. In other words, the individual gets knocked on their butt, they get unconscious for a little while, they get very dizzy for a while, they don't see any bleeding, they're ready to get back at it, when really there's been a great deal of damage in the brain. If you look at the concussion blast, if it starts here, that pressure wave decreases the further you get away, but it's still going right through that helmet. That helmet's not stopping anything in terms of that pressure wave. Let me give you an example. If you have a roommate or a brother or sister that has the room next to you and they put on their stereo, and they put on their music, and they're not wearing headphones, you can hear the deep bass sounds of the music. That's because right through the wall, those deep, high energy, low frequency waves come traveling through the wall. These are the same thing, except times that by 100 or 1,000, and you're seeing the power of that energy going through the helmet, and the person can be 100 yards from a big blast and not get any of the shrapnel, but still have a great deal of damage done to the brain. And when you look at this and you talk about people's original cognitive functioning, even when they got knocked out and they return back to a normal function, if they're in a coma for any length of time, that return cognitive function is not going to take place. So what we're seeing a lot of, because we had these wars that go on for such an extended period of time, we call them the invisible wounds of war. They haven't lost a hand or an arm, and they might not even have open head injuries, but thousands of them have been close enough to explosions that they get these mild traumatic brain injuries that go through the brain, and they're not bleeding, but it doesn't mean we aren't doing a great deal of damage. And that leads to concussion and dizziness, and that might not go away. What's interesting about these kinds of stuff is it varies between people too. And you can't just put your finger on, oh, that person's not going to have a lot of side effects because of traumatic brain injury, and that person is. These are the signature wounds of war. Another thing that what's happening, which is a good thing, is, it used to be, let's take the Vietnam War or World War II. About 25% of soldiers died from their injuries, bullet wounds and things like this. In today's war, about 10%, which is really good news because we have such great advances in medical technology. That said, we have a lot of people coming home with tremendous damage to their brain and their head. And so these are the kinds of things that are characteristic of brain injury today. What goes with traumatic brain injury, even mild traumatic brain injury, even post-concussion syndrome, those go hand in hand with post-traumatic stress disorder. We see post-traumatic stress disorder diagnosis go way up when we find out that a soldier has been close to an explosive device. Hand in hand. Look at these numbers. This is the year 2000. These are the incidents of armed force branches, the different armed force branches, and the brain injury. Look at these numbers go up. Okay, and this is somebody who is going to try to come back maybe and get a job and have memory problems, emotion problems, behavior problems, self-administration of anxiolytics like alcohol and things like this, and post-traumatic stress disorder from their brain injury. Okay? Even cases that aren't traumatic brain injury, mild traumatic brain injury, even the post-concussion syndrome, 97% reported getting knocked out or getting really dizzy and feeling those symptoms up to 3 months later. That's some serious damage. 20 to 40% of active duty soldiers enter a deployment with symptoms from a post-concussion syndrome. And, that can be extremely dangerous if they're back in there. But, this is that kind of culture of wanting to stay with your fellow soldiers or fellow Marines. And so the Army and the Marines, they're really trying to monitor this more closely, monitor that rehabilitation, understand that these wounds occur, physiology changes, neurons are torn, even when you're not seeing bleeding. And what can you do to help that person? How much time do they need? Rest? What can you do to help them? And how that correlates with post-traumatic stress disorder. And for a long time, soldiers denied treatment, and because they would have this pre-existing condition that might affect their deployment, their ability to be with their fellow military members, about reporting PTSD, that stigma that comes along with that. And I think there's a great deal of work to try to mediate that. But what comes with PTSD? What comes with somebody who has concussion syndrome or mild traumatic brain injury, cognitive problems, depression, anxiety, mood disorders? we have a really high cases of suicide. I mean, we had, a really high level of suicide increasing in the Army because of a lot of reasons, but this is certainly one of them. Researchers warn that soldiers may also be prime candidates for future tau protein buildup and CTE. So we have wars that happen 2000, 2012, 13, 14, up in there. What are these people going to deal with in 20 years or 30 years? This early onset of dementia, of Parkinson's, Sonian symptoms, of depression, and things like this. Things that I think if you work in the field, you'll be dealing with quite often.